A 14 years old boy present with enlarged tonsil that meets in the midline. Oropharyngeal examination confirms that finding. You also notice petechial hemorrhage affecting the oropharynx. On systemic examination, noted to splenomegaly. What is the most likely cause? So here, most important point that enlarged tonsil, second one petechial hemorrhage of the oropharynx, and third one is the splenomegaly. And here we have to remember that splenomegaly, it is caused by different organism, and we have to find out one of the organism which can causes splenomegaly and also which can affect the oropharynx and tonsil. So what may be the answering option? Here we can see the oral candidiasis, infection with Streptococcus pyogenes, infection with Rickettsia rickettii, infection with Epstein-Barr virus, and infection with Staphylococcus aureus. So what may be the answering option? First of all, let's see the oral candidiasis. The oral candidiasis, it usually occurs in immunocompromised patient, but here we can see this is the 14 years old boy. That means he is competent, immunocompetent, and not immunocompromised. So oral candidiasis is not a good option of the answering option this question. Then infection with Streptococcus pyogenes. Streptococcus pyogenes, it can cause tonsillitis, but in this condition usually petechial hemorrhage not present and splenomegaly not present. Then Rickettsia rickettii, it is also the rarer cause. Infection with Epstein-Barr virus, it may be one of the option because the Epstein-Barr virus, it can causes pharyngitis, it can causes tonsillitis, and also the splenomegaly. And last of all, infection with Staphylococcus aureus may be occur, but it usually very rare that infection of the tonsil by the Staphylococcus aureus, and in Staphylococcus aureus usually not causes splenomegaly. So now see the Epstein-Barr virus. The Epstein-Barr virus, it is the clinical feature combination of pharyngitis and tonsillitis. So it is very important that the pharyngitis and tonsillitis is present simultaneously. In this condition, Epstein-Barr virus infection is most likely. And this condition also known as the glandular fever. And antibiotic containing penicillin may produce a rash when given in this situation. That means when there is viral infection and we give penicillin in this condition, what happens? There may be rash, and this may mistaken label of the allergy. And infection with candidiasis occurs in individual with systemic illness. That means the immunocompromised, but our patient is not immunocompromised. He is only 14 years old. And the splenomegaly may be a feature of the Epstein-Barr virus. So this point is very important. When there is pharyngitis, tonsillitis, splenomegaly, this triad goes favor of Epstein-Barr virus infection. So 14 years old boy, enlarged tonsil with oropharyngeal infection, and there is the splenomegaly. So tonsil, oropharynx, splenomegaly, they are in favor with Epstein-Barr virus infection. Other option here, such as the oral candidiasis, it occurs in immunocompromised patient. Streptococcus pyogenes sometimes may cause tonsillitis, but usually no splenomegaly. Rickettsia rickettii, not related to this condition, and Streptococcus aureus, it very rare to cause tonsillitis and pharyngitis.